And we're very pleased to welcome Claire Manera, Emergency Coordinator for Gaza at Doctors Without Borders on the show. Claire, welcome. Thank you so much for joining us. I want to start first by asking you, about what you do, which is to provide emergency medical aid. And the question I have is, are you able to do so today? Have you been able to, since October 9th, provide medical aid to every single Palestinian who's come up to say, I need help?
Yes, well, thank you, because what we're seeing on the ground is that we still have more than 200 tons of medical equipment at the border, and the impediments by the Israeli authorities continue, so we're not able to bring this aid in at scale. There's only, I think, 7 international organizations that have been approved by the Israeli authorities to bring in aid, so it's not reaching the people. The levels of malnutrition are extremely high, and for the burns victims from the bombings, they cannot heal. The children are suffering because you need a lot of calories to recover from third-degree burns.
Okay.
So the situation is horrific.
So the answer is not really?
The answer is no,
not at all. Okay.
Not at all, because before the conflict, there were 600 trucks a day coming into Gaza. And now, with more than 94% of the health facilities destroyed, the needs are massive. So 600 trucks is not enough, and we're not even seeing 600 trucks a day.
So Claire, outside of the supplies that you say are needed, what about your colleagues at MSF? How much can they work, and what is out of bounds for them then?
Well, it is still a terrifying situation in Gaza. When I was there and managing the security of the teams, we would provide information to the Israeli authorities of where our teams would be every day to keep them safe. But what we've seen is that our colleagues are still being killed. A few weeks ago, there were 2 that were killed by an Israeli strike when they were clearly marked as humanitarian workers. And to have to work in these conditions when there's no assurances is really impossible.
So it's still a highly dangerous situation. We'll ask you a bit more about the situation on the ground and your colleagues in a little bit. But I want to ask you about all the information that we're getting. Every day we get conflicting accounts. Mm-hmm. This number is going in. No, that number is going in. There's only enough to last 3 months, 6 months. I'm wondering how Doctors Without Borders, gauges what's enough beyond the ability to help every Palestinian that comes your way right now. I mean, what's reasonable? I mean, I've heard also from the Israeli side that say, look, we can't guarantee you because that's contingent on Hamas meeting conditions on the ground as well, and so forth and so forth.
No, these issues are completely separate. So within the health facilities and the hospitals, we need a minimum amount of medical supplies to just continue with our operating theatres, for example. We have inpatient departments of hundreds of beds. So if you imagine in your own country what is needed, and then you have to multiply that because there is hundreds and thousands of people that are malnourished and traumatized as well. So what we receive in as MSF, as Doctors Without Borders, we receive medical supplies. They go into the hospitals. There are no other groups involved in this, and we just want to receive these supplies safely.
Okay, so let's get back to the colleagues that you've unfortunately lost recently. Dr. Omar Hayek in an attack, plus over a dozen killed in Gaza since 2023. Tell me, what's your view on protection of humanitarian aid workers now?
Well, it's been heartbreaking because we've had 15 colleagues killed since the start of the war. And this is in violation to international humanitarian law. So they should not be targeted. And as well, while I was there, the hospital we were working in was targeted repeatedly. We had rockets fired through our windows by the Israeli forces. And even when we called for a stop to that, they would bomb all around the hospital, around the perimeter, so we still couldn't get inside and work safely. When trucks are coming in, they don't reach us because they're forced on roads that are not safe in the middle of the night. So these are all the ways in which I think there's conflicting information. Maybe aid's coming in, but it's not reaching the people that
to
need
your
it.
point,
And
Arnold.
yet you continue. I mean, can you help us understand what drives your colleagues on the ground and you as well every day, despite, these massive challenges?
Well, what drives me is the Palestinian people. They are some of the bravest people I've ever met. And our staff, we have more than 1,000 Palestinian staff, and they come to work every day when they are homeless. They don't have enough to eat. They don't have safe water to drink. But they get up and they come to work. And I think when they're doing that, how can I not do that? And how can the world look away?
Okay. And all the different humanitarian aid groups operating in Gaza have different ways of working, different purposes of being there. Because of the security situation, do you find yourself banding together a little more for that safety in numbers kind of theory?
Yes, we do. We have to band together. But also, Doctors Without Borders are always the first to arrive and the last to leave as well. And I feel like this is a privilege somehow to be able to do this and respond so quickly. But we have our limits. We knew that when the tanks came in a kilometre away from our clinics in Gaza City, we knew that that was a time we had to leave because it was not safe. But since then, we've returned and they are continuing services now in this area.
Speaking of services, one important one that you provide is emergency evacuation for those who need it. Have these medevacs resumed since? I mean, how difficult is it for you to arrange for an emergency evacuation either into Egypt or Israel for Gazans who cannot be treated on the ground in the Strip?
It is still very difficult because there is more than 15,000 people that need medical care outside of Gaza. And just in July and August alone, there was 740 people who died waiting for this medical evacuation. And 1 in 5 of them were children. So again, even though there are some evacuations happening, it's not fast enough and it's not quick enough. And we really are urging for this to happen.
But I'm wondering what the constraint is. Is it because they say you can only do X number, or is it, looking at paperwork and saying this is not done properly? What's stopping you from doing more?
Yes, it's really the fact that only a certain amount can leave at one time. And we need to wait and plan the safest way for them to get out. And all of these movements are controlled by the Israeli forces. So we are not free to have people come out as fast as they need, and it's still not safe to do so.
And Claire, you're reporting that patients have conditions that have deteriorated and they've led into chronic conditions. Can you describe some of these chronic conditions for us? And are they different in adults and are they different in children?
Yes, we have a lot of patients still experiencing physical trauma and burns, and the infections from these, it's really horrific to see, to be honest, because of a lack of clean water and we don't have enough sterile medical bandages. The wounds are basically rotting away. And this can turn into chronic conditions, but we also there are people with cancer, there are people with, who need dialysis, and these are chronic conditions that also need medical evacuation, just like in any country around the world. So this is what the people in Gaza are suffering from still.
All right, Claire, we will have to leave it there. Just want to say we appreciate, the important work you are doing on the ground, you and your colleagues, amid those really challenging conditions. Claire Manera is Emergency Coordinator for Gaza at Doctors Without Borders.